All right. Welcome, everyone, to the University of New Mexico Law and Mental Health Didactic Series. We're hosted by the University of New Mexico's Department of Psychiatry and Behavioral Sciences and the New Mexico Behavioral Health Services Division. I'm Dr. Anthony Pirillo, the Forensic Psychology Training Director in our Department of Psychiatry and Behavioral Sciences at University of New Mexico. Just a couple of things for our talk today. If you look at the bottom of your Zoom screen and see the Q&A box, that is where you will enter any questions anytime you feel comfortable. Just know that we won't get to them until the end. We try at the end to get to as many as possible. Just forgive us if we can't get to yours. And for those of you that want CE credits but are on a tight schedule, you do have to stay the full hour to get those, but you don't have to stay longer than that. We will let you know when the hour is passed. Although we might stay a little bit over to address any questions. For those of you that are seeking continuing medical education credits, there will be a sign-in sheet in the chat box very shortly. And for those that are seeking APA continuing education credits, there will be a link posted near the end of the talk, about the last 5 minutes. You'll need to open that link now when you get it and save your certificate after you complete the survey. We don't keep the copies. You won't be able to get that link once you close out of Zoom, so make sure you open that before you leave the talk. As a heads up for next week's talk, we will have Doctors Lucy Guanera and Dan Murray presenting on evaluating evaluation work rigorously and fairly. But that's next week. This week, let's get to what we've all been waiting for. I'd like you to introduce you to our speaker today, who's going to be presenting on essentials of clinical practice related to firearms. This is Dr. Gianni Pirelli. Dr. Pirelli is board certified in forensic psychology, one of only approximately 300 or so board certified forensic psychologists nationally. He's a licensed psychologist in New Jersey, New York, and Pennsylvania, and leads a group practice, Pirelli Clinical and Forensic Psychology, LLC. In addition to maintaining a full-time private practice, he's taught over 40 courses at the undergraduate, graduate, and postdoctoral levels, and has been very active in research, training, and professional service. Dr. Pirelli's primary areas of research pertain to forensic mental health assessment, ethics and standards of practice in forensic psychology, and guns and mental health. He's given many professional conference presentations and invited talks, and he's numerous publications, including being the lead on 3 books published by Oxford University Press: The Ethical Practice of Forensic Psychology, a Casebook; The Behavioral Science of Firearms, a Mental Health Perspective on Gun, Suicide, and Violence; and Firearms and Clinical Practice, a Handbook for Mental Health and Medical Professionals. He has also published chapters in seminal texts such as the Handbook of Forensic Psychology, and his articles have been published in leading practice-oriented journals such as the Journal of Forensic Psychiatry and Psychology, the Journal of Forensic Psychology Practice, Professional Psychology Research and Practice, and Psychology, Public Policy, and Law. An additional note is Dr. Pirelli's research has been cited in amicus briefs in the United States Supreme Court and the New York State Court of Appeals, and in the United States Department of Justice President's Commission on Law Enforcement and the Administration of Justice Final Report. Dr. Pirelli, on behalf of the University of New Mexico, can I just say we're very excited to have you join us. We're thankful for you sharing your expertise. And of course, as a personal statement, I can't thank you enough for coming. It's really good to see you, and I can't wait to hear you share your expertise. I will now throw it to you.
Thank you, Dr. Pirelli. Hello, everybody. It's always a really great honor and privilege of mine to speak to colleagues in the field. And in fact, this particular talk is created for you, or has been created for you, in the sense that the last book in particular that we have coming out, you have here, Firearms and Clinical Practice, was literally created for you, medical and mental health professionals, as well as students and trainees and so forth. The reason for that is because I've been working on these topics for many years. And after kind of putting together a compendium of sorts in 2019 on a firearm-related book, we wanted to create something that would really be kind of a best practices feel, with tips and vignettes and so forth. And that's this green book here. And so, of course, this is a disclosure statement. Of course, I make money in theory off of these books, but more importantly, I hope you will find them useful. They're extremely affordable. I'm very proud of Oxford for doing that. They're very low cost, and I'm not certainly trying to sell any books to you, but point being, if you are interested in more hearing more of what we talk about today. The Green Book will be very action-oriented for practitioners, and the Red Book is really just a very comprehensive text. Okay, and the objectives today certainly are to talk about certain relevant statistics and factors related to violence and suicide risk. You won't hear me use the term gun violence. I'll also explain why I use certain terms and why I don't use certain terms. I know it's election day, but you won't see any politics in this talk at all, even though it's a very hotbed issue. We stay as neutral as possible. I think avoiding bias at all costs and any impartiality and so forth. And I think as a full-time clinical forensic practitioner who testifies in court and so forth, that helps me even more so staying in that neutral spot. And we're also going to talk a little bit within the context of a model we created, which is Know, Ask, Do, KAD, and that's to give you principles to walk away with respect to firearm-related issues in practice. Now, just a note on cultural competence, and you'll hear me revisit this at one point. Oftentimes we think of cultural competence in terms of, sex, race, gender, religion, and so forth. But undoubtedly, if you really look at the broader definitions that have been adopted by our leading organizations in recent years, it is certainly something that encompasses belief systems, values, and so forth. So in a little while, you'll hear me note different firearm-related subgroups or subcultures, if you will. And so I want you to also be thinking about cultural considerations with respect to people who interact with firearms or who have been impacted by them negatively or positively. And so we'll talk about that. Okay, the general overly ambitious outline we have is firearm basics, gun ownership statistics, firearm-related laws, issues of violence and suicide in relation to guns, and emerging roles for us. It should actually say medical and mental health professionals. And so that is, as I said, overly ambitious. I have many slides in this talk, and I did that on purpose because it will be materials that you can have in terms of a PDF. Just know that there will be certain pieces of information I will undoubtedly skip over for the sake of time, but that's okay. That's there for you to reference back. You can also contact me. I can, send you reprints of certain articles or just answer any questions you might have if you don't have the opportunity to hear something that I might not touch upon today, or that one of your questions doesn't come up later. Okay. And so the first thing, and I probably don't have to convince you all that much that this is an important topic. You're all here today, and I appreciate that. But I do want to hammer home how important it is briefly. We have called it an essential competence, and we have a paper out not too long ago. I have Lisa Gold from Georgetown on this. Basically, I want to read this component to you right here, which is essentially it says many lawmakers and others, media and so forth, basically think that we as medical and mental health professionals are equipped to deal with a lot of these issues. And this is not a slight to anyone. It's just a reality that, as we put here, it's as a result, these groups often set forth positions and engage in discussions and promote policies that are at least partially based on the widely held but incorrect assumption that medical and mental health professionals are either inherently equipped or professionally trained to intervene with their patients and reduce gun deaths. And we certainly, I think, should be, but we're not ready for a lot of that. And so a lot of times the cart gets put before the horse, or the horse, is not even present. And so that's, today's a great starting point. My goal today really is to heighten your awareness and bring up questions for you. Hopefully you leave with more questions and answers. If that's true, then I think I've done my job. And so here's another kind of quote that I put in the book that's coming out. The so-called stay in your lane debate is simply a red herring, seemingly fueled by frustrations from those on various sides of gun safety and Second Amendment issues. The truth is this: as medical and mental health professionals, we have not even established a lane yet. When 9 out of 10 of us have not received formal training in gun safety and other firearm related areas, we haven't even left the driveway. And so, again, I'm not going to spend too much time convincing you this, but I'm going to just give you an example of here's over a handful of studies, for instance, that just show really poor numbers. Psychologists, social workers, psychiatrists, in terms of training. You'll see here, somewhere in the region of 10 to 15%, depending on the study, have gotten any training at all related to firearm related safety, very few residency programs. And that, again, doesn't even speak to knowledge related questions as to guns. And in commenting on that, it was one special issue came out, and Simpson noted, if you see there in blue, Nagel and colleagues make a strong case for the incorporation of training on this topic into the curriculum of all U.S. forensic psychiatry fellowships. And I would certainly, of course, agree with that. And we've made that point in the past as well. And not just psychiatry, obviously, all medical and mental health, because we can't have it both ways. We can't say this is an endemic, gun-related deaths, and then not teach it as a core part of our training. And of course, if nothing else, suicide risk assessment, and of course, violence risk assessment, but certainly suicide risk assessment, which is a cornerstone of medical and mental health training, well, it's inherent to that. And the biggest issue is, how can we know if someone's being safe with firearms if we don't even know what firearm safety is, for instance, and other kind of more nuanced issues related to guns. So today, again, I hope to give you just a little bit more to think about in that respect. Okay. And this is, again, the model we kind of put together, which is basically 4 components: gun culture, safety and laws, when and how to ask about guns, how to assess risk, and intervention options. Now, I've done 10-hour trainings on this, and it still isn't enough. Obviously, there's a tremendous amount to talk about, like most topics that are so involved and newer for a lot of people. Let me just say a few things. I'll weave in these components as much as possible for the sake of this talk. But again, I'm really just trying to highlight some things that you're going to want to maybe look into further. For instance, and momentarily, we're going to go into firearms. I'm not a tactical expert, and many of you may even be more proficient in your understanding of firearm basics and so forth. And that's true, probably in many cases, because we're dealing with the whole country here. I'm a New Jersey person, and we only have 10% gun ownership. We're not exposed to as much as certain others. But needless to say, I'll won't make any assumptions, and we'll just go through what we go through today. And hopefully you can take some aspects of it and apply it to your work. Now, I always like to start with this slide when I really get into the substantive stuff of this talk. And I always give the trick question of which one is a firearm, or which A or B, which would be a firearm. And of course, I already told you it's a trick question, because the answer would be B. That is an antique firearm, which was was on top, that rifle, was manufactured before 1898, and therefore is not even considered or defined as a firearm under federal law. Whereas, as you see here, Part D, any destructive device such as the explosive and so forth that I showed you before, is a firearm. And so, I like to just remind people, and I like to start with this slide. If you think you know about firearms and guns and mental health, hopefully this slide will start to humble us all, because I know for me, I've written on this topic for almost a decade now, and I get humbled every day. It's a very, very nuanced, and this is just a simple example. Okay, now just a couple of basics to get us thinking about it. This is a semi-automatic handgun. I'm certainly not going to sit here and teach you all the components of firearms per se, but just to point out certain issues. One is, you might hear about magazine capacity, right? And so we're talking about how many bullets essentially are going to fit into this semi-automatic firearm. Now, I've used already some terms you hear in the media. Now, those familiar with guns probably wouldn't think twice, but some others, when you hear semi-automatic, you might think of Rambo or something. The fact is that most firearms that you're going to see in this day and age are going to be semi-automatic. And that simply means that it's going to cycle the bullets every time you pull the trigger versus an automatic gun, which is a single depression of the trigger and, let's say, spraying bullets. And that would be an automatic firearm versus a semi-automatic firearm. The only real alternative, I mean, there's a million different types of guns, but the only real alternative that you would see is a revolver. So it's not a semi-automatic. It's going to cycle around, right, and revolve, hence the term. And this kind of what you would see as an old police firearm and the like. Now, police stopped using them because the firepower on the streets that can't keep up. And so they moved to semi-automatic, and most police officers are going to use something like a 9mm semi-automatic firearm. Now, the reality is, and we're not going to get too much into this, I promise you I wouldn't get into politics. It's kind of difficult when we talk about guns because it's so inextricably linked. But the reality is, this is why I don't like hardware laws so much, as they call them, because, for example, in New Jersey, we have a 10 bullet, if you will, capacity to the magazines. They reduced it from 15. But the reality is, particularly in a state like ours, where virtually nobody has firearms, there's no significant difference between having 4 15-round magazines or 6 10-round magazines. Unfortunately, if somebody wants to commit, a horrible tragedy, and nobody essentially has carry permits, at least to this point in our state, unfortunately, the likelihood of them being stopped is going to be very low, particularly when the average response to a school shooting, for instance, is like 12 and a half minutes from law enforcement. So, and we've seen obviously worse than that. So some things to be thinking about. Hardware laws, as I call them, are a lot less compelling. We really need to focus on risk assessment and so forth in many ways, but we'll get to that. Here's just an example of all the variety of different sizes you'll see underneath the bullets. You're going to see different numbers. And that's when you hear, 9mm, 45, 357. This is what they're talking about, essentially the size of the bullet. Let's just say that in terms of the let's say width on top. I'll just try to keep the term simple. Here's an example. And of course, that's not the necessarily actual size, but it's a relative size. You see on the bottom of 22, you may hear of 22 rifles. You see kind of train kids in the Boy Scouts on that versus 9mm. You'll see the fourth one from the bottom up kind of in the middle there, actually 9mm. That's what I was talking about versus a 45. You'll see on top. You may have heard people talk about 50 caliber Desert Eagles. That's even slightly larger. So we're talking about the size of the bullet. Okay. The other thing I'm going to point out to you is that the look of a gun doesn't mean all that much. The media certainly likes to use different looks to evoke certain feelings, but most of the time, just looking at a firearm is not going to tell you all that much, and we'll get back to that. Let's talk about long guns for a moment. It's a rifle. That's ammunition for a rifle. Again, it's just endless. That's why, if anyone tries to simplify guns to you, please be skeptical, because there are just countless different sizes and components of different types of firearms and what have you. It's very complex. This is just a simple poster showing just a multitude of different sizes of firearm ammunition. Now, here's another thing to point out. Now, these are rifles. They're, basically hunting rifles is what you're looking at versus semi-automatic rifles. Now, in the news, you're going to see more of these kind of military style looking rifles. Again, it kind of evokes a different emotion if we just look at it. We think of hunting, you see the camo and what have you, versus this looks like, kind of scary. Now, incidentally, I'm not here to minimize anything in terms of firearms. Certainly any firearm effectively with any size bullet essentially can hurt or kill somebody. So let's just kind of get that out of the way. I'm certainly not here to say that that's not the case, but we're just pointing out that by looking at these pictures, it's not telling us anything about the firearm, right? So here's another trick question. I told you I was going to ask you a trick question before. Here's another one. You have you have a look at these guns. You say, okay, which one is the most dangerous, if you will? Okay, relatively speaking. Now, if you were putting a news story together to make it look scary, you probably picked the one on the bottom left. But what I'm here to point out to you is we have no idea. Essentially, we have no idea, because the one on the bottom left could possibly be shooting that 22, which can be used for plinking, metal and what have you. Again, it could still certainly hurt and kill somebody. But I just want to point out to you that looking at the firearm alone doesn't tell you essentially anything. That one on the bottom left could be shooting that bullet that's all the way on the left up there in the middle top, or it could be shooting any one of them going down to the 22, which is, tiny. And so just keep that in mind. I like to just heighten people's awareness if they're not familiar, that by looking at a firearm, unless it's a very specific gun and somebody truly knows about guns, by simply looking at a firearm in the news or in an article or something, you have no idea what the capacity of that firearm is. Just pointing that out. You'll hear of different gun manufacturers. Again, you can go back to this on your own time. You'll see different names here that you may recognize. And here's another list. It's a little difficult to read here, but a list of different manufacturers and basically how much they manufacture in a given year. One of the key things to talk about is firearm safety, obviously. Now this, you'll see the National Shooting Sports Foundation. Unfortunately, we don't hear a lot from the National Shooting Sports Foundation. You really hear more from the NRA, and the NRA, because of a lot of the political back and forth, again, evokes a lot of emotion, but really they're the same types of safety principles. And certainly you can go through this on your own, but I will stress that to the extent that we believe firearm safety is important, then we just have to remember who's actually going to teach that, right? And so it's going to be gun ranges and so forth that actually are going to be able to teach gun safety. And so we're not going to learn that really in our legislators aren't going to teach that, on either side and so forth. So we can get to a lot of these quote unquote debates about the Second Amendment, but, by and large, we have to think about where really gun safety and training is really happening. And in my experience, at least in New Jersey, the local gun range is a lot of retired officers and military. And so there are really a lot of experts around. Now, just a note on child safety programs. These programs, particularly Eddie the Eagle, has been criticized. There have been different studies showing that even after teaching kids, not to touch a gun, they'll still go and grab one, and they've done certain experiments in that respect. I believe that because, frankly, if you look at the DARE program, if you remember, drug abuse program, resistance education, I think it went on for 29 years before they recognized it wasn't ineffective and they had to change it. Scared Straight actually had to be stopped, and states were threatened with funding being pulled if they continued. And so a lot of programs, may not work the way we want them to work, but that's kind of an ongoing discussion. But there are certainly programs that try to teach education and safety to children as well. Okay, and I'm certainly not going to go through terms with you. Again, these slides will be made available to you, but I want to model for you that, we should be learning certain language. Now, you may think, look, I'm not a forensic psychologist. I'm not interested in guns. That's all well and good. But if to the extent that you're working with any patients and at any point you're going to need to do any type of suicide risk assessment or violence risk assessment, you want to have at least a general working knowledge. Think about this. When we ask people about guns, I just say we, collectively, just as a general rule, typically it's just one question. Do you have access to guns? And the person says yes. And then we just think it's a high risk situation and we move on. We just consider a high risk factor. But imagine we did that with substances. Imagine you said to somebody, do you have access to alcohol? And they said, yes. And we said, okay. And then we didn't ask any additional questions about substances. We just moved on and said, okay, check, that's high risk. That wouldn't fly. We would certainly want to know what type of substances the person uses, how often, how long have they been using them, what's their last use, what's the frequency and the amount, right? We already have kind of a working knowledge about substances, so we feel comfortable and we understand that you can't just say to someone, do you have access to substances? But I think as a field, we've given ourselves a pass, frankly, because we don't know that much about guns unless it's personal experience. We certainly don't learn it. 90% of us don't learn it, in any classroom. I went to one of the top forensic programs probably in the country, and we never talked about guns or gun related questions in any real way. So this does have to be instituted, some of this language, some of this working knowledge, and it's really, again, for broad medical and mental health professionals. So we hear AR-15, again, you hear these things in the media. Look, I testified in front of a judge not too long ago, a few months ago. She thought that AR stood for assault rifle. In fact, the officer didn't know, that was testifying before me. I was the one that had to come in and clarify that it was Armalite rifle. And again, I'm not even a tactical expert, but just having a little bit of a working knowledge can help us contextualize things. Even knowing certain things like a box of ammo is typically 50 bullets, right? That helps us understand things. When they say, oh, there's, person was found with 100 bullets, that may sound like a lot, but, or 100 rounds of ammo, but that's only really 2 boxes. And frankly, if someone's going to order them online or have them delivered, how many, they're usually going to order even more than that. So we want to have to start having some context if we're if we're going to try to understand some of these issues. So again, you can go back to some of these types of definitions, but I want to just point out certain types of terms like semi-automatic, AR-15, automatic, so you can start to think about what it really means and try to take some of the emotion out of what happens in the media and legislators. Okay, bottom line here is over 40% of homes in the United States have a gun. Okay, the general statistic we have heard over the years is there are about 100 million gun owners and 300 million guns in the United States. People can have their own opinions about that one way or another, but what it tells me is we're not going to get rid of guns in the United States. So a lot of people have very unrealistic expectations. You have no compromise groups, essentially. You have people who say any gun law is an infringement on their right. And then you have other people saying, I don't want to hear anything about guns. We have to remove every single gun from the United States. And I just, again, don't bring my personal view to the table, but just professionally say, well, those are just unrealistic positions. So I think we just need to stay within reality and understand what the issues are, and then talk about, risk and mitigation and what have you. And then every kind of jurisdiction and federally will figure it out as they will. But we're here as medical and mental health professionals. The bottom line is we have to deal with this. There's a good chance that you're already working with firearm owners. You don't know maybe who might be. Now, certainly in certain states, it's going to be very common. I did a talk once in Georgia, and I talked about certain gun issues, and it was kind of a silly conversation almost. But in other states like New Jersey, people are shocked to realize that there are gun owners on their patient list. So something to think about. This is kind of a general breakdown of the country. You see here, New Mexico, for instance, approaching 50% there of gun ownership versus New Jersey. You'll see 11%, right? And so it's ranging. It kind of probably matches what you might imagine in terms of gun ownership in the country. Now, this is an interesting slide because this is gun carry throughout the United States. And you'll see actually New Jersey second to last at the bottom. That might be changing a little bit. This slide certainly we expect to change a bit because of a Supreme Court ruling we'll talk about in a little while. But it may stay proportionally the same. And so this is gun carry versus just gun ownership in the house. And that, there's different states that have different laws and restrictions on that. But the bottom line, what I really want to drive home is not any single number, but the concept of local norms, right? As a forensic assessment principle, but even as a psych assessment principle, local norms, right? We could sit all day, we could spend the next 5 hours talking about federal statistics statistics, national statistics, and all that is well and good, but it doesn't necessarily apply to you and your patient or client in front of you today, right? And so obviously kind of general statistics are a decent starting point, but they may not be similar to your local norms, right? And so, of course, you've seen over the recent years with psych testing and other issues, there's been this push for local norms, and that I cannot stress enough. Hopefully, I'll say that 10 more times today, because what I, again, want to model for you is thinking and how I think of certain things here in New Jersey, New York, Pennsylvania, where I work, and how you can kind of apply that. You know, for instance, in the book that's coming out, we have a vignette about an African-American female who's 23 years old who applies for a handgun permit in Newark, New Jersey. Okay. She's essentially a statistically zero of harming herself or others with a firearm. Now, again, we're talking about probabilities, not possibilities, right? So it's a cross-examination question I have to get through a lot. Isn't it possible, right? That's like how they always say, yes, everything's possible. We're talking about probabilities, not possibilities, right? It's a starting point, is the point, local norms. The problem is our policies, and you see, you know, police department policies, so forth, they'll treat everybody the same. And so that's how you exhaust your resources, obviously, right? If you're taking the highest risk groups, and you're treating them the same exact way as the lowest risk groups, then you're going to just exhaust your resources. And you see a ton of that, right? I'm sure you see that in different areas. You see that with sex assessments. You see that in a lot of different areas where it's just like, okay, everybody is required to do the same exact thing and is looked at in the same exact way. That is fine if that's what a society wants to do, but it doesn't make sense from a base rate standpoint when, again, you have certain groups that are statistically zero. Now, again, that's where the assessment comes in. That particular person obviously may have significant risk factors. But again, as evaluators, whether you're a treatment provider or an evaluator per se, you know, an evaluating professional, we all have to do evaluations. Again, even if it's something like a suicide risk assessment. So don't forget that. You have to remember that you will always be doing some sort of assessment, and these are important principles. Now, I'm just going to point out a couple of issues related to firearm-related laws and federal law and what have you. Now, of course, you've heard of the Second Amendment, and that was ratified in 1791. But as you'll really see, for quite a long time, there was nothing going on with guns. In fact, I would really say that not until the 60s do you even see anything significant in terms of gun laws. So again, 1791, you have Second Amendment. It's not really until the 1960s, right? So we're talking, you know, over 150 years later that you actually start seeing gun laws. So a lot of people don't realize that this is actually very new, most of this stuff. And incidentally, the 60s is relevant because you have the assassination of Martin Luther King and John F. Kennedy Jr. And so this is not surprising, right? Because we see with the insanity reforms with, you know, the Hinckley and Reagan, right? So whenever you see very high profile presidents and what have you, things start changing significantly. So really 1968, remember that in your mind as being a very significant turning point in terms of gun laws in the United States. The ATF is only 50 years old, right, 50 years old. It was created in 72. And then you'll see other things that you may have heard of, the Brady Bill, and, you know, NICS. That's worth knowing. The NICS check is your kind of federal background check. People go for firearms, NICS. What's interesting, though, is believe it or not, the three landmark cases are just so new. You're talking about in the last 15 years, we've had the three landmark Second Amendment cases. And I'm not going to go into any real depth here, but you have Heller. You may have heard of DCV Heller. You'll hear Heller being mentioned. And that's really the first Supreme Court Second Amendment individual rights case, where basically it's determined that there's an individual right to keep and bear arms. Now, that gets extended in the subsequent case of McDonald versus Chicago, okay, where the Supreme Court says, okay, that extends, you know, basically throughout the country. And And ultimately, it comes down to this concept of the individual right to keep and bear arms is the prevailing view in the higher courts. It's a long story, and we don't have time for today, but there was this concept of an individual right versus a collectivist right, meaning a state's right, because you see the term militia in the Second Amendment. However, Scalia, the late Justice Scalia in Heller, wrote the opinion in Heller, and spoke of that being a prefatory clause, and how basically that's the only right that anyone was arguing was not an individual right. So again, a little bit more than we need to get into today, but just to give you some heads up on that. I hear people talk about Second Amendment all the time, and they just have never read these cases. And it's very important to understand, really where everything came from. Now, this just came out in June. This is a New York case, and it's basically called Bruin. And essentially, it says that the New York carry law was unconstitutional because it required a special need. The person had to demonstrate a special need to carry, and there were sensitive places designated and so forth. And the same thing in New Jersey, they had to show what's called a justifiable need. So a lot of states now, like New Jersey, New York, have been trying to pass new laws, create all kinds of new sensitive places, because I think they understand that they're not going to be able to prevent carrying of firearms by civilians. They're just going to make it very difficult. So that's ongoing. That's a new issue. But again, interesting thing is that it's only been 15 years since you've had now this trilogy of landmark cases in Second Amendment. Now, in terms of state gun laws, they're very wide ranging, right? And so, that's where we get back to this concept of local norms. I could sit here and talk about federal law all day, but it's really, you have to understand what the state laws are in your jurisdiction, like transportation laws, child access prevention. Does your state have, you see there on the bottom, red flag laws called extreme risk protective orders, or gun violence restraining order laws, or other types of forfeiture laws? Is very important. And the other thing is you have to keep in mind, and have there in red as well, procedural difference within the state. When people call me in New Jersey for firearm related evaluations, I tell them, forget about federal discussions, forget about state by state discussions, the media, legislators, politicians, all that stuff. This is like, for many people, it's like, a speeding ticket. There's so much discretion, built into a lot of laws in states like New Jersey and what have you. And so it literally, in a state like New Jersey, has 565 municipalities, and every town is different. Each police chief issues their own firearms identification card. So if you move to the next town, you have to get a new card. You could be approved by this chief and denied by the next chief a month later. So you have to zero in on local norms. If you're interested in the political discussions of the Second Amendment for your own personal interests, that's fine. I would strongly discourage you from trying to take anything from that to apply to the case at hand that you're dealing with, because it's not going to mean much. You have to really understand what your statistics are in your region in terms of gun deaths and the laws and what have you. Once again, someone may be doing something perfectly legal or not. And of course, we're not investigators, and it's not our job to necessarily worry about every single law. But to the extent we're going to think that someone's being unsafe or irresponsible with firearms, if we're expected to comment on that or view that in a certain way, then we need to know what is expected. And so this is just an example from Gifford's Law Center. For instance, just to contrast, you have a New Jersey getting an A- for gun laws, which is meaning they're strong, obviously, California, versus New Mexico, F, so relatively weak gun laws and everything in between. And here's another ranking, and again, you can kind of read that on your own time. Again, it's very wide ranging, and it's pretty light overall in terms of the gun laws in this country. Once again, they're kind of more recent. And so you can read this on your own as well, but you'll see that very few states even have, mandatory reporting of certain things like stolen guns and other conditions. Now, we're going to pivot, of course, now to kind of mental health issues and what have you. The concept of the mentally ill mass shooter with an assault weapon is a bit of a fabrication, frankly. And it doesn't mean it doesn't happen exactly, but it's literally taking from the lowest base rate in every single area. So mental illness in terms of violence is a very weak predictor, as I'll talk about momentarily. Mass shootings, as they're defined by the government, are extremely rare relative to other gun deaths. And an assault weapon, which is usually what they mean, a semi-automatic rifle, not even an assault weapon exactly, as I talked about before, is also basically the rarest form of gun death. So this concept, this kind of media and political concept of the mentally ill mass shooter with an assault weapon, is literally drawing from the lowest base rates in each kind of respective area there, and then putting that face on a database of gun deaths, which are nothing like this picture. And I'll talk about that now. And this is why I don't use the term gun violence, incidentally, and we'll get back to that in a moment. But just an example, every time for gun safety, this is Mayor Bloomberg, and I think Moms Demand Action are part of this, I believe. But in the past, they used to call them school shootings. See here, 272 school shootings in just 1 year. And they've changed that because it's misleading. And they've now called it gunfire on school grounds. And we don't have the time to go through why. But when we talk about school shootings, again, it kind of evokes a certain active shooter scenario. And that's actually not the data that they were using. They were using any discharge of a firearm on any school ground. So it could be police chasing a subject in the street, and then it just gets on the driveway of a college campus. They were calling that a school shooting, these types of things. And in fact, Giffords points out that a myth that children are most likely to experience gun violence at school. So really, when you start digging into the data from a relative standpoint, now we're not talking about emotion, obviously, we're just talking about statistics now. And to the extent we want to use evidence-driven, data to create evidence-based policy, I will tell you that by and large, most of the policy is not driven by the predominant data in these areas. It's driven by the lowest base rates, tend to be more emotional ones. And you'll see here suicide at the top is actually the biggest gun kind of related concern. So we'll get back to that in a moment. So what about active shooters then? That's a more kind of appropriate term rather than school shootings or mass shootings, because now we're starting to understand what that means. Active shooter, you've heard that term, active shooting situation. And those numbers are quite different. So you're talking about a 13-year period, 160 incidents. That's quite different than saying 270 school shootings in 1 year, right? And this is the same period, and this is the FBI analysis. So when we actually start clarifying our terms, school, active shooter versus school shooting, and we start paying attention to what we're talking about, the numbers are much different, much lower. Listen, every gun death is significant, and we need to address each type. But if we take everything and put it all into one database, right? And I've done a couple meta-analyses by now, you have this concept of garbage in, garbage out. If your policies and so forth are based on data that's just every gun death thrown in, you call it gun violence, that's why you have ineffective policies, basically. And that's what we deal with a lot, especially in states like mine. And so I said you had 486 active shooter deaths in that 13-year period. That's what the FBI tells us. In that same period, it's more commercial airline fatalities, 670. Now, why is that relevant to say? Because if you were to go to a therapist, for instance, and you say, I'm afraid to send my kid to school because of school shootings, they might say, well, that's a reasonable fear. But if you say, I'm afraid to fly, then they would say you have a phobia. You have a specific phobia, even though the number is actually greater. And so that just kind of gives you a sense that sometimes we're thinking more with emotion than data. And that's okay. That's okay if we want to create policies based on emotion. But we just have to be clear about, are we being more emotional driven or data driven? So we hear this 30,000 gun deaths a year. You hear that a lot by politicians and so forth. And the reality is that 2/3 of them are suicides. which again is a horrible thing that we need to address. But think about the terms that, again, and think about how it gets played out. So the concept, and we've heard from journalistic authorities, from mental health authorities like NAMI and others, saying we don't say people committed suicide, right? We don't use that terminology anymore. We say people died by suicide because it's more of a victim understanding that it's a victim issue, right? When we say committed suicide, we say die by suicide. But then we say gun violence, even though 2/3 are suicides, right? You see, so this is, I told you before, I don't use the term gun violence. It's pejorative because 2/3 of the people in that database have died by suicide. And it's also misleading, in my opinion, because I had colleagues say, well, there's self-directed violence. Okay, of course, I understand that, but the average person in the public does not think, oh, that's right, suicide is self-directed violence. They don't think that way. They think violence is interpersonal violence, suicide is suicide. So I have a very big problem. And as I said before, we're seeing the face of the mentally ill mass shooter on databases that consist of 2/3 of people who have died by suicide. You know, I think it was Naomi Watts, or I believe, forgive me if I get that wrong, a few months ago, died by suicide, I think, with a firearm. I could be wrong. You know, that's considered gun violence, right? In most databases, that's a problem. So something to think about. But once again, local norms, because in my state, it's actually 60-40 homicide to suicide. So if I just went by the national statistics and I go into my courtrooms, you know, in New Jersey, and I just ran with those numbers, I would actually be incorrect, because we don't have 2/3 suicides in New Jersey. It's a slightly flipped, okay, in terms of gun deaths. So I don't know. You have to obviously look in your respective jurisdiction and to kind of get a sense of where your numbers are. And so that's, again, one of my main principles here is local norms, look at your own stats. By the way, it's not difficult to find. Most states are going to have readily accessible databases that you can just easily get from home, you know, just searching, you know, death, mortality stats, and what have you. As I said, we put 3 books out, no funding, because it's all accessible, you know, frankly. Anyhow. And this is an example in New Jersey. You know, I start to look into, all right, where are the homicides? All right, Essex, you might know Newark, Camden. Okay, those are 2 different counties. 50% of the homicides in New Jersey are in these 2 counties, and 75% of them are with handguns. So now I'm starting to understand the layout in my state of who dies by guns and how, and not necessarily why, but you can start to get close to the question of why. And that's going to help form my local norms starting point in my mind. So this is what you want to do in your state, to start thinking this way. What are the numbers geographically, etc. Okay, versus suicides in my state. Instead of the 2 main city areas, the urban areas, you're seeing in the rural areas. New Jersey is an interesting place. You have hardcore kind of inner cities, and then you have hardcore rural, and they're not that far from each other. But now I know that the homicides in New Jersey are predominantly with handguns in those city areas, and the suicides by young, urban, kind of poor minority male, you know, type of concept, versus the suicides are in the rural areas with long guns, older white male. Okay. And I also know in New Jersey that law enforcement and corrections are 30% higher risk than their same age peers. And again, policies don't reflect that because they're actually immunized in most of the laws. Even though it's the highest risk group. And so again, emotion, politics come into play. So these are the types of things that I want you to think about with your stats in your jurisdictions. Now, as I said, mental illness is a weak predictor of violence in general. Only 3 to 5% of acts of interpersonal violence are even thought to be attributed to severe mental illness. Nevertheless, benign mental illness. Now, of course, some diagnoses are particularly relevant, like active alcohol use disorders are, you know, a big flag. And certainly in terms of acting out kind of antisocial personality disorders and so forth, you're going to see that, of course, with crime, as you know, in terms of, you know, bipolar disorder is more associated with suicide. So we know, obviously, there are stronger or weaker connections, but by and large, it's a fairly weak predictor. Okay. And the problem is, again, in states like mine, everybody who has any diagnosis at all gets flagged. So the person with, very benign depression gets put through the ringer, denied, perhaps has to appeal, go through this whole process. Someone who hasn't even gone to treatment may just skate by, even though they have things that are very problematic, like revenge-related factors and these concepts of like damaged masculinity and the things you see in young men and what have you. So there's this idea that if you go to treatment, that's a risk factor. Well, as we know, that might be a great thing. It's actually, there's this silly concept that people not going to treatment are just fine. And we know that that's not true. So it's complicated. You can't legislate all this stuff away. This slide, I don't have a lot of time to go through each part, but I'm just pointing out here that you have to then go a step further. And in other words, you can't just say, oh, there's domestic violence, so that's a risk factor. What are the actual risk factors related to lethal domestic violence? Okay, because in New Jersey, for instance, there are 62,000 domestic violence calls a year, but only 133 of them involve firearms. And of course, only a small portion of them become fatal. And so to the extent that we want to really do a proper assessment and know what's a specific risk factor, we want to get into, as you see, factors that don't fit neatly into a DSM, right? And there's not necessarily anything wrong with the DSM. That's a whole nother discussion. But my point is, you'll find that a lot of the firearm related concerns are not just going to fit neatly into diagnosis. They require an assessment of other issues, jealousy, what have you, these types of concepts. Okay. And that was the example I was just telling you about New Jersey, 62,000 incidents a year. But look at the weapons used. In fact, firearm is the least likely involved in domestic violence, at least in my state, but it's the only thing that's taken pretty much when the police show up. Now, if they want to take the gun every time, that's not up to me to determine. But my point is, there are a lot of other things, cell phone, car, and so forth, that are actually causing much bigger problems if we go by the data. Once again, do we want data related policies? Now, so where do we come in? And this is, the last, portion of our talk here. And I always struggle because I don't want to get caught too much on the laws and everything I just provided to you, but I have to also be data driven. And if I know that the vast majority of us don't have any of that real exposure, education, those foundations I just went over, I want to demonstrate to you that that's an important starting point. I get called all the time from systems and they say, oh, we want training related to quote unquote gun violence and this and that. But I explain that until you have the foundational knowledge, it's hard to then just jump into risk assessments and, overarching policies. So I hope at least I've heightened your awareness to some of those previous issues that we talked about today. Okay. As to where we can then go from there, remember what I said about cultural competence. Okay. There are different firearm related subgroups. You have shooting sports groups. You have, Second Amendment kind of activist groups. You have people who are gun owners who are not particularly interested in the debate at all. You have liberal gun owners, you have conservative gun owners, obviously. You have people who are victims of firearm related crimes. You have people whose family members were. You have people who were family members died by suicide, right? You have obviously law enforcement. You have people in gangs and other criminal activities. So there's many different firearm related subgroups, as we refer to them. And you have to just remember that the likelihood of crossing paths with somebody who has basically pretty easy access to a firearm is quite high. So this idea of, oh, I'm going to ask, do you have access to a firearm? Yes or no, and that's enough, is really poor, to be honest, because you have to go beyond that, not only for the reasons I said before, but just realizing that almost everybody has access to a gun, okay, whether we like it or not. In fact, there's even reports in my state, I think it was about 15 years ago or so, where there was a gun in the maximum security prison, and you probably have had that in your regions as well. So I would actually give you the opposite starting point to think of, which is assume that everybody has access to a gun. The question is it readily identifiable access, or is it easy access, as we talk about? And number two, okay, is can you distinguish between two of those people? In other words, it's easy to distinguish between, you hear a lot of this happening in again, kind of political debates and what have you. Oh, gun owner versus non-gun owner. It's kind of more of an academic concept on paper, gun owner versus non-gun owner. Yes, I understand that. That's obvious. If someone's a gun owner, of course, their risk of doing something with a gun is higher than someone who doesn't have the gun in front of them. We know that. But the real question, if you're going to talk about applied principles and practices, you have two gun owners. Can you distinguish between their risk, right? I could distinguish between a gun owner and a non-gun owner. That's giving ourselves a pass and say, well, yeah, there's a gun present, higher risk. Yeah, okay. But what about when there's a gun present in both situations, right? So I work with, I've done a talk, for instance, at Jersey Battered Women's Shelter and some of these groups. And a lot of these groups are going out in the field, obviously, and they're working with many different gun owners and what have you. It doesn't help to say, oh, well, if there's a gun, it's a high risk. That might be true, but not, you can't just necessarily flag the person and take away the gun forever. So there has to be some concept there as to differentiating risk and contextualizing it, just like any other risk assessment. The other thing I want to point out is this concept that I call the therefore problem. Clinicians all the time get asked to write letters and all kinds of things for gun suitability and all kinds of kind of forensic issues anyway. Can the person return to school, disability, all these things? And what I always advise is you can go as far as reaching the point of therefore. In other words, you can provide a treatment summary if you are a treatment provider, but if you find yourself to that therefore sentence at the end, you should stop, right? In other words, I've explained the person's issues, their diagnoses, risk factors, whatever you want. But if you're going to then say, therefore, they're suitable for a firearm, or therefore, whatever, now you're getting into a potential forensic role. And that's a whole nother conversation. But again, just remember that kind of mnemonic in a sense of the therefore problem. If you find yourself with that therefore, you might want to stop there, or at least consult at that point. And the other piece there is what I call weapon focus. A lot of clinicians who consult with me will, and when I say clinicians, I mean medical and mental health in different disciplines, different roles. They get tripped up if they're not comfortable around firearms. And again, there's certain states, many of you I'm sure may have personal experience, and it's not a second thought. But for a lot of people, they don't. And so they'll get tripped up on there's a firearm involved. And so then they start altering their procedures. And I want to just encourage not to do that. You want to still stick to your procedures. You want to be consistent, because risk is bidirectional. If your threshold is way too strict and you're basically flagging everybody, well, then you're raising your professional liability risk, where people can make complaints against you because you're unnecessarily flagging them. It could result in removal of firearms and what have you. Versus managing the risk that you think the person might pose to the community. So like all types of liability, you have to kind of manage that. And I know we only have a couple minutes here, so I just want to point out a few more things. And again, you'll have the slides. But remember, our model here is then this know, ask, do. And there's four main components. It's gun culture, safety, and laws. Now, once again, you don't have to be an expert in this area, but just have a little bit of a more of a working knowledge maybe than you did today before you walked in. Maybe start to look into a little bit. And it doesn't have to be everything. Maybe just transportation laws and, magazine capacity, certain things you just get a handle on. When and how to ask about guns. Certain jurisdictions have different restrictions on that, or at least they've tried to. So pay attention to that. And again, in some of my slides, we talk a little bit more about that and some of the articles we've written, and how to assess risk, but not just regular risk or suicide risk, but firearm specific. Think of that slide with the domestic violence risk factors. That also applies to suicide and violence. You can't just say someone's high risk or low risk, or they are or they're not at risk. There's different levels of risk, and risk is obviously needs to be contextualized. And so someone might be at notable risk, but not necessarily firearm related. Someone may not be at risk for certain things and for risk of other things, obviously. And so we want to pay attention to that. Now, crisis situations are one thing, but a lot of us are not necessarily crisis settings. So we have to think about that. And then intervention options again. So in the slides that follow, I'm not going to have the time to go through now because we're out of time, but you'll see some of the bullet points in each of them as to the types of areas I'm recommending you maybe think about. Now, obviously, this is a kind of best practices, idealistic outline, because of course that's what I want to promote for the future, is for people to think in that way. And just like we do with substances, and we think about substance and how much we've learned about substances, and all, you can ask 50 questions right now about substance use risk, but we only have one for firearms. So to the extent that we can get closer to that is good. Work from a prevention-based standpoint rather than prediction. And again, you can read more about that and some of these other concepts when you have the time, or you can certainly follow up with me. And that's the story.
Thank you, Dr. Pirelli. You've given us a lot of information. I'll be going through the questions here, throw some your way. A couple of people wanted to just clarify when you, as you had noted, you weren't sure you referenced Naomi Watts. It was Naomi Judd who you were referencing.
Thank you for that.
We had a recent comment that talked about, given the sake of time, we didn't really get to talk as much about suicide. Any particular advice for patients who are suicidal and then tell you they have guns when there's no red flag law or way to have it taken away? This person also brings up a specific example. They said they've heard of therapists taking possession of the guns themselves. They seem a little skeptical of that idea.
Yeah. So suicide, now again, I always kind of give the preface or the caveat that, of course, all deaths are important, and we need to look at them differently. And we will say that the main issue from a number standpoint is suicide, as I pointed out. Okay. And so it's an important question. Now, yes, most states don't have red flag laws. Last time I checked, I think it was like 16. Maybe it's a little bit more, but certainly less than half even have red flag laws. However, most states have a duty to warn and protect mechanism. And so the real question, in a sense, is not necessarily imminent risk, because typically, I mean, unless you have something very obscure in your state, I'd be interested if you want to email me, but typically every state is going to have some sort of imminent risk provision, duty to warn and or protect type of concept, where you can do something. The real issue becomes that middle ground where it's not imminent, it's not reportable in that moment, but you're concerned enough that you want to do something. Okay. Now, depending where you are, like for instance, in my area, there is a place, it's called gun sitters, for example, and people could store their firearms off site. Okay. And, I would just, for the sake of time right now, I would encourage people to look into a couple of things. So look into what's referred to as means restriction counseling. And if you look that up, you'll find a little bit more information about some intervention ideas, and just working and talking with clients and what have you. But also, it's a great question. I'm sorry that I didn't mention it during the talk, but I'm happy to have that opportunity now. Look at your local areas to see if, where's the closest storage type of facility. And you might be surprised. There might be someplace within a region. And it's not just for that person. I'll get calls from a person say, oh, my son made a threat, or my son's struggling through this, or, what have you. And the police are, they want to return, the police were involved, and there's he needs an eval to go back to school. And I'm a gun owner, and I'll encourage those people to get the guns out of the house. And a lot of these places, are for people when they travel, or people who are on military deployments. So it's a great question, and I'm happy you asked. Look into those two things: means restriction counseling and facilities that can store firearms off site, because the whole point of those red flag laws is the acute risk, right, and crisis phase. And in fact, in almost all of my reports related to firearm ownership and what have you, I talk about that it's about crisis, not mental health diagnosis, right? It's about the crisis, not the diagnosis. So thank you for the question, and I encourage people to look at that. And of course, in our writings, we have more information too, but those are the two areas.
We have a question here about how do you feel that ghost guns are going to impact risk assessment as they're becoming more and more common, and how would you assess for associated risk?
Well, if we're talking about ghost guns, meaning firearms that weren't, legally purchased, I would say this. Let's remember that most crimes are committed with illegal firearms, in terms of gang-related violence and what have you. I pointed out in my state, for instance, the inner city problems with firearms. Governor Murphy's been tracking where the guns are coming from. They even posted on, you can look on the state website. They have certain, which states they're coming from, these types of things. You also have 3D printers I didn't talk about today. So I also had a slide from one of my other talks, again, just for the sake of time, and put in, frankly, you can make a firearm by going to the hardware store if you know what you're doing. And so that's why I don't love the hardware laws, as I call them. Not that there's there should be some regulation, obviously, that's kind of out of my area in the tactical arena. But the bigger problem is if you have someone who's intent on doing harm, particularly when we start talking about active shooter situations, there's a good chance, like I said before, they're going to be able to get to a gun. Now, again, even in a strict state like mine, you have gun ranges. All you need is a license to go in and shoot a gun. You don't even need the ID card and what have you to go and shoot it. And there's been some suicides, in New Jersey. It's not common, but my point is, by and large, if somebody wants to get their hands on a gun, when you're talking about 300 million known guns in the United States, probably, and much more, they're going to get their hands on a gun. And that's why kind of, from a risk assessment, from a threat assessment standpoint, we have to get in there and get involved at that preventive stage, and if we're kind of more concerned, at least, we're concerned about everything, but in terms of this question of active shooter, mass kind of shooting, school shooting thing that tends to be the hotbed issue, then we have to talk about where the numbers are. Just like I said about the African-American young woman who's looking for a handgun at a Newark. Look, it's going to be the basically teenage white male, and I used the term before, damaged masculinity. Peter Langman out of Pennsylvania has written a bit about this, and he did a really interesting couple pieces and even a book on going through different school shooters, to use the term, and talk about the physical deficiencies that they've had, and again, that concept of damaged masculinity, right? Them getting the gun, making them feel more powerful. We have to have that conversation and get into those environments if that's what we want to address. But the real take-home message, I hope, for everyone is we can't do everything at once. We can't just say, we're here to deal with gun violence, and that's what we're doing, and we're all kind of patting ourselves on the back. We can't do that because the way I'm defining it, the way that the people are talking about defining it are including every type of gun death at the same time, right? They're talking about suicide. They're talking about the school shootings. They're talking about accidental shootings. They're talking about interpersonal violence, domestic violence, gang violence. So it's nice to talk about gun violence, but you're literally talking about 20 different types of gun deaths that probably have 20 different approaches that are necessary to address those types of issues. So that's why, I hate to kind of be like the wet blanket about it, but we have to start with the terminology and the stats and figure out what are we really talking about and where do we want to go from here. I get calls from like colleges and different places, and like I said, systems, they want to do something about whatever. I say, okay, I need to see your data first. I need to see your data, right? If we're going to make decisions, I need to know what's happening, and then we go. But because it's so emotional and political and this and that, I think we lead, in the wrong way. So the suicide issue is the main issue from the number standpoint. And but remember what I said about the confusion that we have. We say die by suicide, and we're viewing it that way, but at the same time, we're talking about gun violence and perpetrating gun violence. And we're putting a face onto the database that's inaccurate. So I think before we really get to the intervention stage, we have to look at the groups. And I'm talking about leading groups, by the way. I'm not going to name names, but leading groups that are policy institutes and so forth that are, tons of funding, that are perpetuating a lot of this, and we have to dial it back because we just spent 50, 60 years destigmatizing mental health, and now we're re-stigmatizing it. You know, there's a lot of work we have to do about getting it right as to what we're talking about, and then on a case-by-case basis dealing with it and systemically dealing with it.
In your response, you've mentioned the need to understand the statistics and the data, and we've got a couple of questions here about curiosity about updated statistics or data. I'll throw one at you right now where it says, it looks like the common risk factors for lethal violence that you showed was from about 1999, which might be prior to discussions of specifically things that you referred to, like damaged masculinity. Is there a more updated list of different risk factors or fairly recent risk factors that have emerged in recent times?
Well, yeah, I mean, there's obviously, from like when I was talking about mortality statistics and what have you at the state level, those are constantly updated. They're usually a couple years behind, but, and of course I haven't looked at every state, but for example, I'll tell you New Jersey, because I was critical about one group in New Jersey pre-pandemic or going into the pandemic. There was a lot of concern and, about there's going to be all these additional gun deaths, right, and so forth, and there hasn't been. The suicide, the firearm involved suicide gun rate in New Jersey hasn't changed in decades. It essentially hasn't changed in decades, and by and large, a lot of the numbers haven't changed all that much. They wax and wane, but even you see with like the gun ownership, if I can go back to that slide just for a moment. Yeah, so just bear with me here. That's the example of gun ownership, and this is a Gallup poll, from 1960. And I'll just represent to you. I mean, obviously, if you're really interested in the stats, the red book we did, like I said, it's like almost 650 pages. You can get every stat you want, and pretty much from there. But what you're seeing in front of you right now, there's little ups and downs, but by and large, it's followed like a certain, pretty steady pace. That's what you see a lot of times. This kind of, let's call it regression to the mean, effect. There are bumps, that up and down that you'll see, and it's based on different national events usually, or local events, obviously. But let me point out one thing. A lot of times it doesn't. Again, it's bi-directional. It's not going to follow what you think it's going to follow. In other words, when you see like a really bad, active shooter school shooting tragedy, you may think, oh, well, we have to get rid of the guns. But the gun sales wind up going up a lot of times, because then what happens is, and again, I speak to New Jersey, for instance, there was a doubling year after year, because what happens is the gun owners and friends of them and different, think, oh no, that's a bad event. The politicians come out and say, we're going to lock down, right? And we're going to restrict, and then people go out and get more because prohibition doesn't really work, And so what you're going to see is, if you actually look at it from gun ownership statistics and so forth, the biggest surges have been with like President Obama, Governor Murphy in New Jersey. The people who have been most outspoken about guns, that's led to the biggest surges in gun sales and guns on the street, actually, and so forth. So you just have to keep in mind like that pendulum swinging. So yeah, I mean, some of the stats in this particular talk may be older, but keep in mind that some of the very specific ones, like the studies haven't been updated. But that's why I represent to you, the best thing to do is go to your state's kind of mortality data. It's usually for your Department of Health and what have you. And not every state, I guess, but my state, for instance, is quite good with that, where you can really be very specific, the type of death, there was a gun involved, this and that, and you can get some really good, I mean, it's not gonna get better than that. I could cite all kinds of national stuff. It's not gonna get better than that. If you're from, Iowa, and you can go to your state kind of health statistics website, and you can punch in, this, that, and the other thing, and gun related this or that, and you could break it down. So, like, it depends on the database, but ours is really good. You could break it down by gender and ethnicity, different things like that, race, whatever it may be. That's the best possible thing you can do. So hopefully I modeled that today. Like I said, that local norm perspective.
Well, we are unfortunately out of time. But thank you so much, Dr. Pirelli, for everything. I know you said during your talk, your goal was having people even have more questions than answers here. I imagine people have a lot to think about and a lot of questions that they'll continue to have. So I appreciate you sharing all of this info with us. That is a wrap for this week's University of New Mexico Law and Mental Health series. We hope to see you next week when Dr. Lucy Guarnera and Dan Murray talk about evaluating the evaluations that we do as forensic psychologists. Have a great rest of your day.
Thank you.